For instance, with the guy that was so hypertonic, when he would go to move, he was so rigid that he wouldn't allow himself to move freely. So I was literally like, dude, just like try to relax your muscles. And what I might just say is, what I want you to do, these are my go-tos, I'll say, hey, or they might say, I've got pain with side bending, right? So then you have them, I'll get out of the way, but you have them set up so that they can visualize their back. That's the key, they just need to see it. If you remember in the literature, it shows that even just the visualization of their back facilitates down regulation. You're more aware sensory-wise of the area that's in pain than an area that you hardly ever look at, right? So I'd say, hey Dilbert, I want you to try to touch your toes. For today, we'll just say 5 times. Just go down nice and relaxed. Don't think about tightening this or doing that. Don't think about anything else. But here's the key. Dilbert, when you do this, you need to be looking at the mirror. So what I might say is, go to the point where you can still see your back. So obviously you might pass an area where you're getting too far, where you just can't pick your head up, right? So I'd say, all right, Dilbert, go ahead and bend forward. Make sure you can see your back, and then come back up. Okay, and again, do that 5 times. And what they might be like, oh, but it kind of hurts. Well, I say, all right, well, maybe just don't go to the pain. Or, hey, remember that even though if it might just hurt, it's okay, right? Because it's safe. Then I might say, all right, Dilbert, do some side, that side bend left was painful, side bend to the left as far as you can. What I might do too is, as long as I'm out of the way of the reflection, I might say, all right, try it again. Just so they can see, I might say, hey, can you go a little further? And now I'm helping them, right? So I'm guiding the movement. I'm not necessarily overpressuring them, but I'm guiding them. So it becomes a little bit less threatening because they know I'm here for them and here to help them, right? I might say, hey, side bend left. I might say, hey, you know what? Try some squats. Keep watching your back though. Do some squats. Just don't worry about form. Just drop your butt to the ground, see how you do. I might say, do that. How about marching in place? Right?
That's weird. I've never seen my back.
Thank you.
So strange.
Right? And it really is. I mean, it is. It's crazy because you never look at it. So think of an area that you never look at. Your body's going to naturally want to protect it because it's not exactly sure where it is, what it's like, what it looks like. Right? So I would argue that every morning when you get out of bed before you get dressed, look at yourself in the back. Look at yourself. Check it out. Feel it. Right? So that's easy application for spine, right? It's really easy. You just need 2 mirrors. Even if they're 2 rolling mirrors, you just have to set them up. I might say, hey, Dilbert, turn your head to the left, right? You've got neck pain. You've got pain with left rotation. Now, this is where it gets tricky, so maybe go to the right so that you can actually see it. So I might say, hey, you just keep watching the reflection and watch yourself. And then I might have to reposition it depending on which direction. Okay?
Do you try to alter their quality of movement at all?
If, for instance, with the guy who was like super rigid and stiff, I try to alter it. I'm not necessarily focusing on mechanics. I am trying to improve quality of movement, but especially if they're guarded or limited, then I might try sort of. But more often than not, it's just, hey, just allow yourself to move and actually just see what's happening normally.
Okay.
Because you're trying to establish that homeostasis. I'm not trying to give too many inputs that might alter or change the perception. Super easy application, right? The only thing is it's a little more intimate, so you might need a treatment room or in a day in the clinic when it's not as busy, and you set up the mirrors, okay? You put your shirt back on. So another thing here, right? With the mirror.
So for females, you'll have them gown up so that they can actually see the skin?
I'll tell them to wear a sports bra.
Okay.
The key with this thing, as Dilbert said, I've never seen my back before. So if you do it with clothes on, you're still not seeing your back. When you do things with extremities, right? So let's say, for instance, with extremities, you guys will see it better if you're over here. Come here. So let's say, what's your name?
Dustin.
Dustin?
Yeah.
Nice to meet you. So let's say Dustin has a painful arc, take your shirt off. I might not necessarily have them take their shirt off if I'm doing extremities, but what I will say is, and this is going to be troublesome, but I'll remove jewelry. He's got tattoos. I will cover him up. Even if I'm just using tape, like kinesio tape that's same color, I'll cover it up. But in this instance, you're coming over here. In this instance, this might not work or be as effective. Because, how long have you had this?
Not very good. Couple months.
That doesn't help. Let's say he had this for 3 years. Let's say he had this for 3 years, right? The neural signature of his arm and the cortical representation has a tattoo as well, at least for the last 3 years, right? So if you're doing extremities, you need to remove, for instance, if they're married or jewelry, you have to remove that because their left hand and their right hand, left hand's always used to having the watch, but the right isn't. So if you do it with the jewelry on, it's going to alter their perception of what's going on. So I might say, hey, Dustin, step forward. I'll demo what you're going to do. But hey, you've got pain when you raise your shoulder, right? But kind of like here. So what you're going to do is you're going to kind of angle yourself like this. Now you're just watching the reflection in the mirror. With extremities, you want to do uninvolved side first and then involved side. With spine, it's just about the visualization. So he's got a painful arc in his left shoulder, or shoulder pain. So I'd say, hey, Dustin, this is what you're going to do. You're just going to stand here. You're going to watch your reflection. You're just going to raise your arm up and down. Maybe do that 5 times for today. I'd typically have people do 10, maybe up to 15. Maybe do like like you're kind of hugging someone or high-fiving. Maybe do like a little row action or like you're pushing and punching somebody. So try that 5 times on here. And usually they're like, well, that's kind of weird. Or, that's not too bad. What do you think?
It's kind of weird.
Yeah. It's going to be more weird if he didn't have tattoos. Because for the last couple months, he's establishing that neural connection that arm should have a tattoo. Now, so I said, all right, you did 5, 10, 15. Now, Dustin, now I want you to do both sides at the same time. So you kind of have to cradle. That's the thing. You have to get really close to these mirrors. But now you do both at the same time. And then that's when they're
That's
like,
even more trippy.
yeah. That's when people start to really freak out. They have this weird experience, but then they're like, they get it. They're like, oh, wow, this makes sense. Especially because then they're like, oh, well, what you'll see, so you guys can see, this is what happens with patients. They might say, hey, it hurts to lift to here, or that's all the range of motion that I have. And what will happen is that they do this. And when you assess them before, they were getting to here, right? But you do this, and then you're having them do both at the same time. And it might just be the distraction of the mirror itself, but then they start doing this. And they're like, oh, it feels like it's going the same. Or they might be doing this, but they're like, it feels like it's going the same. And you're like, oh, well, it's okay. Just keep working on it. And then next thing you know, they're doing this. And then I might say, all right, now look over. And they go, oh my God, how cool is that, right? So that's easy application for upper extremity, right? So let me show you guys what I do. Julie, where'd you put the mirror?
It's in the front over here.
So, yeah, just real quick demo. I know everyone wants to leave, but I'll show this and then one more thing. So, I already broke a mirror in clinic, so I can't break this one. I'm dead serious. So, Hannah, do me a favor. Hannah, do me a favor.
Yeah.
Sit here. So let's say Hannah has pain in her left foot. Maybe she fractured and she was immobilized. So it's pretty, you're thinking, well, that's pretty nociceptive, right? She had a fracture. It's very consistent, normal ag and easing factors. Oops.
It's all right.
Sorry.
Don't worry.
So I might say, all right, Hannah, so, sorry, I keep saying opposite. It's her right foot. Right foot that fractured, right foot that hurts. So I might say, Hannah, all right, this is what you're going to do. You're going to look at the reflection, okay? Just focus on the reflection. Now, the caveat is that before I do this, I tell them about the body's brain maps. And I tell them about sensitization. Kind of how I told you guys, just a slight little variation of the story I told you guys, but it incorporates the body's brain maps. I might say, hey, Hannah, do me a favor. Close your eyes. Lift up your left hand. How'd you know that was your left hand?
Just because.
Just because, right?
I learned that.
Okay, now close your eyes. Touch your left index finger to your nose. How'd you do that if your eyes are closed? How'd you know that that's where your nose was? And then it's like, well, I don't know, because I just know. Well, no, you know, because there's an area in the brain associated with the visual representation of who you are and where you are in space, proprioception. So Hannah, your right foot hurts, right, when you move it. So now, Hannah, so now just move your ankle up and down, and you watch here. Keep watching. It's kind of weird,
Yeah.
right? So now, Hannah, you might do inversion, eversion, right? Now do both at the same time.
That's really weird.
And then if you really want to trip people out, have one do like inversion, the other do eversion, and then they're like, oh. It's crazy, right?
Yeah.
So then here's the thing too. So like for my lady, she has pain to pressure or palpation, right? So then I might do something like this, or I might say, all right, Hannah, let me borrow your foot. And I can do this at extremities as well. I might say, hey, how does that feel? And you say, that feels fine. That's not my foot that hurts. Watch here.
Okay.
Is that weird?
Yeah.
Does it feel like I'm touching on the other side?
No.
Not so much, but it's just
Not
weird,
so much,
right?
but it's just weird.
So then what I'll do is, as I'm doing that, this is what I was doing today actually. I was doing it like this. I was really just cranking on her heel. And then I might say, all right, now hang on, I'm gonna do both. I'm gonna borrow your other foot. And I just start doing both. Now what you guys don't see that she might feel is the pressure. Keep watching the mirror, don't look at me. Does the pressure feel the same on both sides? Feels a little different?
Yeah.
So sometimes I'll even get a little tricky and I'll apply really deep pressure on this side and lighter pressure on this side, but the visual feedback makes it feel like it's the deep pressure to desensitize the other side. And I'll gradually load up the pressure. And then I'll do it the same on both sides. Right?
Yeah. It's really weird.
Yeah. And so that visual feedback is so important. And if you guys saw it, right, like I said, active range of motion, it's painful. Full passive range of motion, but not active range of motion. Sensitized states, right? Obviously with the CRPS, phantom limb pain post-stroke. But even just some of these day-to-day things, right? You're thinking, oh, that's pretty nociceptive, right? She broke her ankle and it hurts when she puts pressure on it. That's like normal. Don't really have to do anything nervous system-wise. Why not? You can have this impact. And like I've had people that, oh, I had a flare-up, and now it's just like it hurts when I move it all the time. All right, well, let's pop out the mirror, do that for 2 minutes, now do both sides. And once again, it's like a reset. It makes it feel better. You're limited on your creativity, because then it's like, oh, well, Hannah's like, well, it doesn't hurt when you press on it, it hurts when I step on it. Well, then I'm like, okay, Hannah, I keep saying Hannah.
Second.
Could you move that out of the way? Stay there. Then I may say, all right, so now this is what we're gonna do. So she's a little bit taller, so I might even flip that on its side and use that, but I'll say, all right, so now I just want you to look here.
Okay.
What I want you to do is I want you to start pressing the weight on your left foot. So imagine there's a bug underneath your heel. Now just start pressing on it really hard, right? And so you're retraining weight bearing, right? So she's just mashing her heel, watching the reflection. And then I might say, all right, now do both sides. And then start doing both sides. Or I might even have people in standing and really just like toe touch over here, but full weight bear here, and have them do stuff like this. And then shift it over. So you just have to get creative, right? Okay, so then last thing, 2 things real quick. For the 2-point discrimination, I just use these. Real simple. When you're doing it, just light dimple of the skin. And you might say, you'll just do a demo, right? Like I'm gonna do it here. Does anybody have back pain? Where do you hurt? Take your shirt off. Turn around for me. I'll demo to them where? Where do you hurt? Okay. I'll demo to them. This is what I'm gonna do. 2 versus 1 point, right? So I'm gonna touch you and you're gonna say, hey, can you tell that's 2? That's 1, right? So that's how you start. So then, normative ranges for the spine are anywhere, I think it's 55 plus or minus like 10. So let's start here. Then I'll go and I'll say, hey Dustin, tell me, oh damn, there's a mirror. Do it this way. But I might say, maybe that way, so they can see. I might say, hey, 2 versus 1, are you ready? Typically I have them close their eyes as well. Correct? 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 Demo. I'll go to the side of pain. Are you ready? You said right around here?
A little higher.
A little higher? Right where Texas is? Sure. But you don't know because you've never seen your back.
About around Brownsville, huh?
Yeah, right around Brownsville. Yeah. All right, so you ready? Correct?
1,
Correct?
2,
Incorrect?
1,
Correct?
1,
Incorrect?
1,
Correct?
2.
Correct. So a little bit less accurate, and that's actually 65, so it's more outside the normative ranges. Let's try maybe something closer to normative ranges, right? The key with this is that while you're doing it, they need to get that auditory feedback if they're correct or incorrect to validate what they're feeling. Even if they're incorrect, they're at least feeling it, and so it could help, right? So you're right? So this is closer to normative ranges, still outside though.
2,
Correct?
1,
Correct?
1,
Correct?
2,
Incorrect?
2,
Incorrect?
2. Okay.
Good guess. Correct?
1,
Correct?
2,
Correct?
2,
Correct?
1,
Correct?
1,
Correct?
2.
Incorrect. So maybe 70% accurate, right? And that was a lot closer to the normative values, just still a little bit outside. So I would say, hey, he's got sensory discrimination impaired. A little bit different when you're central to compare, like if it was left-sided low back pain or thoracic pain, well, you compare to the opposite side. But in the pamphlet that you guys have, you have the normative values to reference and say, hey, okay, yeah, that's not normal. So hey, I would say instead of trying to find wherever your rib went, it's lost, I would say maybe do some sensory discrimination. Maybe you realize that you have a tattoo back here, visualize it, and I would say that I would argue that that might help more than maybe anything else he's tried, right?